Good morning. The following class is in the subject of anatomy, course code UMD 23ANACT 101. The topic covered in this class will be posterior compartment of leg. Faculty name: I am Dr. Anju Balaji More, Professor in the Department of Anatomy. I am working in Sri Lakshmi Narayana Institute of Medical Sciences, affiliated to Bharat Institute of Higher Education and Research, Pondicherry, 605502. In this class, we will cover the topic related to lower limb, and that is the posterior compartment of leg. The posterior compartment of leg is the compartment which lies on the posterior aspect of leg. So it is also called as just posterior compartment, or for a lay person it is the calf region. It is also termed as posterior crural region. Since the muscles which are involved in this compartment, they are the flexor muscles, this compartment is also called as the flexor compartment of the leg. So these are the other names for the posterior compartment of leg. As we can see in this diagram, the posterior compartment of leg is shown here. The diagram is a cross section of the leg region. So we can see the two bones. The larger one here is tibia, which is lying on the medial side. The smaller bone is fibula, lying on the lateral side. In this diagram, this is anterior, this is posterior, this is medial, and this is lateral. So the boundaries of posterior compartment of leg are: anteriorly, the posterior surface of tibia, posterior surface of tibia, the interosseous membrane joining the lateral border of tibia to the medial border of fibula. This is the interosseous membrane here. Then the fibula, posterior surface of fibula, and then the posterior intermuscular septum, which starts from the fibula and is attached to the deep fascia, which forms the sleeve-like compartment in the leg. The posterior margin or posterior extent of the posterior compartment of leg is formed by deep fascia of leg. Here we can see the deep fascia of leg forming the sleeve, which is containing all the contents of the compartment within. So the contents are the brown colored muscles, blood vessels, arteries and veins, nerves, and these muscles are also separated from each other by intermuscular fascia, as well as there is another deep fascia which divides the posterior compartment of leg into a superficial part and a deep part. So with these boundaries, the posterior compartment here we will discuss, and the topic will be covered under the following headings. So we will discuss the skin and superficial fascia of the posterior compartment, the cutaneous nerves and vessels in this region, the lymphatics, fibrofatty tissue, deep fascia, and the muscles, vessels, and the nerves. The each compartment in the limb region is always covered under the same headings which we have enumerated here. So the cutaneous nerves in the posterior compartment, the nerves which supply the skin over the posterior compartment of leg, these include the saphenous nerve, posterior division of medial cutaneous nerve of thigh, posterior cutaneous nerve of thigh, sural nerve, lateral cutaneous nerve of thigh, sural communicating nerve, and medial calcaneal branches of tibial nerve. So in total, we have 7 nerves here. All these nerves supply the skin over the posterior compartment of the leg. So in this region, we see the dermatome, that is the area of skin which is supplied by each nerve. The diagram shows the area which is supplied by sural nerve, the saphenous nerve, superficial fibular nerve, and medial calcaneal branches from the tibial nerve. The next diagram here shows the root value of each of the cutaneous nerves. The common peroneal nerve has root value L4 to S1. Saphenous nerve has root value of L3 and L4. Superficial peroneal nerve L4, L5 and S1. Sural nerve S1, S2, and the medial calcaneal branch of tibial nerve also S1 and S2. So these are the nerves which supply the skin over the posterior region of the leg, and these are the spinal segments which give rise to these cutaneous nerves. So these spinal segments are responsible for cutaneous sensation over the posterior compartment of leg. Now the vessels which are in the posterior compartment of leg. We need to understand here that the posterior compartment, or for that matter for any compartment, the cutaneous vessels and the nerves will lie in the superficial fascia. That is, they will lie over the deep fascia just beneath the skin. Now the veins which are present in this region in the subcutaneous tissue are the great saphenous vein, the small saphenous vein, and other small tributaries. This region also shows the lymphatics which will carry the lymph to drain into the lymph nodes located in the popliteal fossa. Now, as we have seen in the other limb compartments, the deep fascia is the thickening of the fascia, and this fascial thickening forms a tight sleeve which holds all the structures within the appendage or within the limb. So the deep fascia is also named as fascia cruris, and the modifications of the fascia cruris include intermuscular septum and the flexor retinaculum. The intermuscular septum, here we can see there are two intermuscular septum in this diagram. I am showing with the cursor. This is the anterior intermuscular septum and this is the posterior intermuscular septum. In case of leg region, both anterior and posterior intermuscular septum are attached to fibula. The anterior intermuscular septum separates the anterior compartment or the compartment containing extensor muscles of the leg from the peroneal compartment. Between the anterior and the posterior intermuscular septum is the peroneal compartment of leg containing the lateral compartment muscles, that is the peroneus longus and brevis. Posterior to the posterior intermuscular septum and the intraosseous membrane between tibia and fibula is the posterior compartment of leg. The posterior compartment of leg itself is divided by another intermuscular septum here into a superficial region and a deep region. So the region will respectively contain the superficial set of muscles in the calf region and the deep muscles in the calf region. Both the muscles in the superficial and deep compartment of the posterior region of leg are the flexor muscle. So this together is called as the flexor compartment of the leg. Now these muscles will have a long tendon and these muscles will go for its attachment to the foot. So as these muscles cross the ankle joint, the long tendons of these muscles will be held by another modification of deep fascia, and this is called as flexor retinaculum. Similar flexor retinaculum we have seen as a band of deep fascia over the wrist joint. There in the flexor compartment of forearm, it was holding the flexor tendons of the forearm muscles as they enter in the form of tendons to the hand towards their attachment. Only difference here is these flexor muscles in the leg, they lie in the posterior compartment, whereas in the hand the flexor muscles were lying in the anterior compartment. In this diagram, we see the said modification of deep fascia, that is the flexor retinaculum. So here in this diagram, we see a band of deep fascia, which is nothing but a thickened deep fascia starting from the medial malleolus, that is the projection at the lower end of tibia, to the medial surface of calcaneus. So this band is forming the flexor retinaculum, and the flexor retinaculum is holding the long tendons. So these long tendons are the tendon of tibialis posterior, flexor digitorum longus. Then there is a artery, that is the posterior tibial artery. The nerve is tibial nerve. The next muscle is flexor hallucis longus. So, deep to the flexor retinaculum, the structures entering from flexor compartment of leg into the sole are arranged from above downwards along the medial side of the ankle joint in the sequence as tibialis posterior, flexor digitorum longus, posterior tibial artery, tibial nerve, flexor hallucis longus. As we can see, these structures are, as they cross the ankle joint, they are lying medial to the talus. Then next they are lying medial to the navicular bone and then the cuneiform bones. Now we will discuss the muscles in the posterior compartment of leg. The first muscle in this region is gastrocnemius. The muscles, as usual, will be discussed under four heads: origin, insertion, nerve supply, and action. Gastrocnemius is a muscle with two heads. One is lateral head arising from lateral condyle of femur. Here in this diagram, you can see this is the lateral head. Medial head arising from popliteal surface of femur above the medial condyle. For insertion, the muscle forms a tendon called tendocalcaneus and it is in turn attached to the posterior surface of the calcaneum. So this tendocalcaneus is also called as Achilles tendon or tendoachilles. Nerve supply is tibial nerve. Actually, the tendoachilles is not just the tendon of gastrocnemius, but it also has the fibers of another deep muscle deep to gastrocnemius, that is soleus. The nerve supply is by the tibial nerve. Action is plantar flexion of foot at the ankle joint and flexion of the leg at the knee joint. The diagram shows the origin of lateral and medial head of gastrocnemius at the respective site, joining of the two heads to form the large muscle belly of the gastrocnemius, its formation of tendoachilles and its insertion at the posterior surface of calcaneum. So this diagram shows the gastrocnemius muscle, its origin and insertion. The next muscle in the superficial compartment of the posterior region of the calf is plantaris. The plantaris is a relatively smaller muscle and it is having a very long thin tendon. The origin is at lateral supracondylar ridge of femur. The insertion is on the posterior surface of calcaneum. Nerve supply is by the tibial nerve. The action of plantaris is plantar flexion of the foot at the ankle joint and flexion of leg at the knee joint. This diagram shows the plantaris at its origin along the supracondylar ridge at the lateral condyle of the femur just beneath the lateral head of gastrocnemius. The long tendon runs deep to the gastrocnemius and is inserted on the posterior surface of calcaneus. The next muscle in the superficial compartment of the leg is soleus. This diagram shows both muscles, the soleus and this larger muscle here is soleus and this thin slender muscle is plantaris. The next muscle that we will discuss is soleus. Soleus is originating from soleal line of tibia. It is the line which is on the posterior surface of tibia. The posterior, the muscle also takes origin from posterior surface of fibula and few fibers from the fibrous arc between tibia and fibula. The muscle, as already said, contributes to the formation of tendoachilles. So, two heads of gastrocnemius and soleus, they together form the same tendon and that is tendoachilles or the tendocalcaneus. And the soleus is also inserted at the posterior surface of calcaneum. That is the reason why we call these muscles together, that is soleus and gastrocnemius, as triceps suri. because we have three heads, one that of soleus and the other two, that is the medial and lateral head of gastrocnemius. These three heads together form one single thick and one of the strongest tendon in the body, that is tendocalcaneus, which is attached to the posterior surface of calcaneum. Another significance of soleus is the presence of venous plexus within the muscle mass or the belly of the soleus. So, with the contraction of soleus, this venous plexus will be compressed and the blood which is stagnated or present in this venous plexus will be pumped towards heart. It will be pumped towards heart because the veins have walls which allow only unidirectional flow of blood, that is towards the heart. So the soleus is having a rich venous plexus and its contraction is pumping blood towards the heart. That is the reason why soleus is called as peripheral heart. So sometimes when we get a short note on soleus, the short note will not ask soleus, but the short note will just say peripheral heart in leg. So you are supposed to write about soleus, and what you are supposed to write? About origin, insertion, nerve supply and action. The nerve supply of soleus is by tibial nerve. Action is plantar flexion of foot at the ankle joint, and it also provides a main propulsive force in walking and running. So what we have come across now is the superficial compartment is having three muscles. One is plantaris, second is gastrocnemius, and third is soleus. Now the deep region of the posterior compartment of leg, deep to the deep fascia, is having four muscles, and these four muscles are popliteus, which is a key muscle for the locking and unlocking of the knee joint and is limited to the knee joint region or to the popliteal fossa. Other three muscles are having a long tendon which cross the ankle joint and reach to the sole, and they run towards their attachment on the sole and to the soleal surface of the phalanges of the toes. So these three muscles with long tendons in the deep compartment of the posterior region of calf are first flexor digitorum longus, second flexor hallucis longus, and the third tibialis posterior. So here what we need to understand is, as we have seen in the upper limb muscles, the muscle which comes with the name digitorum is the muscle which will go to 4 digits. The flexor hallucis longus, hallucis, that means this muscle will go for its insertion to the hallux. Hallux is the great toe. Both muscles are having long tendon, so longus. Tibialis posterior is the corresponding muscle to tibialis anterior. The tibialis anterior is the extensor muscle in the extensor compartment of leg or in the anterior compartment of leg. Here in the posterior compartment we have tibialis posterior. Now, like the three superficial muscles in the posterior compartment of leg, we will now discuss the four deep muscles in the posterior compartment of leg. In the diagram, we see the tendon of flexor hallucis longus reaching for its insertion to the terminal phalanx of the great toe, whereas flexor digitorum longus crossing the tendon of flexor hallucis longus to reach for its insertion to the lateral foretoes, each at the respectively at the terminal phalanx of the lateral foretoes. In this diagram, we see the three long muscles of the deep region of the leg. First is tibialis posterior. The insertion of muscle is seen to the tarsal as well as metatarsal bones. The next muscle here is flexor digitorum longus. The insertion of muscle is to the distal phalanges of the second to fifth toe. The third muscle here is flexor hallucis longus. The insertion is to the distal phalanx of the hallux or the great toe. The fourth muscle here is popliteus. As we can see, it is inserted in the popliteal surface of the tibia above the soleal line. So we will discuss the muscles under the same four headings. First, origin, insertion, nerve supply and action. So first, the popliteus originates from lateral surface of lateral condyle of femur and is inserted into the posterior surface of tibia above the soleal line. You can see the muscle in the diagram. The muscle is supplied by tibial nerve. Its action is medial rotation of tibia on femur. This is the movement of unlocking of knee joint. The knee is locked in the extended position of the knee joint for longer duration to relieve the muscles from their contraction. So, the extended position of knee joint is maintained for a longer duration without the muscles having to work to maintain that position. But when we want to move the knee to the position of flexion, first we need to unlock the knee from its locked position. This unlocking of the knee or the medial rotation of tibia on the femur is brought about by the muscle popliteus. That's why the popliteus muscle is also called as the key to the locked knee. And this is the muscle which will cause the unlocking of knee joint. The muscle is also peculiar in a way that in most of the muscles, as we can see here in case of the flexor hallucis longus, the proximal part of the muscle is having muscle belly, whereas its tendon goes more distally towards its insertion. But in case of popliteus, we see that the tendon is proximal, whereas the muscle belly is in the distal portion. The diagram shows the posterior surface of femur and tibia, and the brown line shows the muscle that is popliteus and the area of insertion of popliteus above the soleal line on the popliteal surface of tibia. Now here we see the fibular collateral ligament on the lateral side of the knee joint. Posteriorly, deep to the popliteus muscle is the arcuate ligament or the arcuate popliteal ligament. Next muscle is flexor digitorum longus. The muscle originates from medial part of the posterior surface of tibia below the soleal line. It is inserted into the bases of distal phalanges of lateral foretoes. The nerve supply is tibial nerve. The action of flexor digitorum longus is flexion of lateral foretoes, plantar flexion of foot, maintenance of longitudinal arch of foot. So along with flexion, it is also maintaining the arc of foot which helps to protect the nerves and blood vessels in the sole as well as gives us the thrust and accommodation over uneven surface. Next muscle is flexor hallucis longus. The muscle originates from posterior surface of shaft of fibula. It is inserted at base of distal phalanx of big toe. Nerve supply is by the tibial nerve and the action is flexion of big toe, plantar flexion of foot and maintenance of longitudinal arch of the foot. The next muscle is tibialis posterior. The tibialis posterior is deepest muscle as it is deeper to the flexor hallucis longus and flexor digitorum longus as well. So the muscle originates from lateral part of posterior surface of tibia, interosseous membrane and posterior surface of fibula. It is inserted into the tuberosity of navicular bone and gives slits to the neighboring tarsal bones as well as bases of the second, third and fourth metatarsal bones. The action is plantar flexion and inversion of the foot. The muscle tendon also help to maintain the medial longitudinal arch in the form of sling. As we can make out from the description of the region that the whole region containing 3 superficial and 4 deep muscles is supplied by tibial nerve. So tibial nerve is the nerve of the compartment. This region is supplied by large terminal branch of popliteal artery and it is posterior to interosseous membrane. So this branch is called as posterior tibial artery. So the region is having tibial nerve as the nerve of compartment and posterior tibial artery as the artery of the compartment. The branches of posterior tibial artery in this region are peroneal artery, muscular branches to the muscles, nutrient branch to the bone in the region that is the tibia and fibula, circumflex fibular branch going around the neck of fibula, communicating branches with the peroneal artery and the anterior tibial artery, malleolar branch at the malleolus. So we have two malleolus here, but this will take care of medial malleolar branch, then calcaneal branch on the medial side, that is the medial calcaneal branch. The lateral malleolar branch and the lateral calcaneal branch will be from the peroneal artery. The terminal branches of the artery after it cross beneath the flexor retinaculum and reach the sole of the foot, it terminates into medial and lateral plantar artery. The nerve of the compartment is tibial nerve. It is the terminal branch of sciatic nerve given in the popliteal fossa. The branches of the tibial nerve in this region are muscular branches to the muscles, cutaneous branches to skin, articular branches to the joint, and the terminal branches after passing beneath the flexor retinaculum in the sole as medial and lateral plantar nerve which accompany the medial and lateral plantar artery, the terminal branches of posterior tibial artery. In this diagram, we see the branches of posterior tibial nerve supplying to the muscles of the compartment and the two joints, that is knee joint and ankle joint, giving the cutaneous branches which we already discussed and terminating as the terminal branches after passing beneath the flexor retinaculum as lateral and medial plantar nerve. The vein in the region which is deeply located is the posterior tibial vein. We already saw two superficial veins in the region as great saphenous vein and short saphenous vein. Great saphenous vein along the medial side, short saphenous vein along the lateral side. So the posterior tibial vein is the deep vein which is formed at the lower border of the popliteus by joining of vena comitantes running along the anterior and posterior tibial artery. The vena comitantes are the veins which run along with the artery on either side. They finally drain into the posterior tibial vein, further drains into the popliteal vein. Then popliteal vein continues further as femoral vein. The lymphatic drainage of the region can be superficial and deep. The superficial region will drain the skin, superficial fascia. It will drain upwards along into the vertical group of superficial inguinal lymph nodes. And the region also drains into the lymph nodes located into popliteal fossa called the popliteal lymph nodes. The applied aspect of the region are tennis leg, tendon of plantaris which can be used as graft, rupture of tendocalcaneus, ankle jerk, deep vein thrombosis, arterial insufficiency, varicose vein, and tarsal tunnel syndrome. Now we will discuss these applied aspects. The tennis leg is a myofascial or tendinous injury of lower limb which is seen in persons who are doing the activity to which they are not accustomed to. It presents as deep sharp pain and swelling and tenderness in the calf region, and the treatment is immobilization. So the diagram shows the location of pain in the penis leg. Peroneus longus is useful as a graft, especially for the replacement of anterior cruciate ligament. So the reconstruction of the anterior cruciate ligament, this tendon is used as the tendon is long, strong, and it is having less morbidity at the donor side. So this tendon is taken from the same person. So it is also called as autograft, and we require a very small incision to obtain this tendon. Next is the rupture of tendocalcaneus, which can be seen here in this X-ray. We see that the posterior surface of the calcaneum is avulsed, and here is a avulsion fracture of calcaneus along with the rupture of the tendon. Varicose veins are elongated, enlarged tortuous veins, and this occurs due to failure of valves. The cause is hereditary. Sometimes the pregnant uterus press over the larger veins, and so the peripheral veins become enlarged. It can be result of obesity, menopause, aging, or prolonged standing due to occupational reasons. The further effect is the leg injury, which can lead to bleeding varicose ulcer, and the varicosity will increase after abdominal straining. The tarsal tunnel syndrome is the compression of the structures as they pass beneath the lexa retinaculum. So with this we conclude the topic of posterior compartment of leg.